Good evening and welcome. On behalf of Dr. Tim Campbell, we welcome you to the Live Well Bethel Park Speaker Series. We have Dr. Rob Dingle from UPMC to talk tonight about sports concussions. So the floor is yours.
Thank you for having me. So before we get started here, just a little bit about myself. I've been practicing athletic training for approximately 25 years. I've worked in numerous settings, including college, high school. I've also taught in the education setting in colleges. So I've seen a lot. I've educated a lot of people. But I've been in my present role for about a year and a half. And in my present role as Concussion Outreach Coordinator for UPMC, I get to work very closely with our neuropsychologists, that are our concussion doctors, as well as performing baseline testing throughout Pittsburgh and surrounding communities on high school, middle school, even elementary school children. So that's basically my background. So this presentation, we're going to talk about basically some statistics on concussions, the proper diagnosis, what one should go through, all right, as well as what are the treatment options these days. All right. So if anybody has a question, just raise your hand as we go through this. Hold on. We're having computer issues here. There we go. All right, so as you can see up here, there are some statistics. Basically about 2 to 4 million sport-related concussions annually. All right. That number is actually more than likely low. Okay, because those are the ones that are actually documented and reported. And that's a big range, right? 2 million to 4 million. All right. The reason being is there's another statistic up there. All right. 50 to 70% of those concussions go unreported. All right. And a lot of that is in high school and collegiate athletes, because they know if they report it, they're either going to be pulled directly from a game or they're going to miss a game. All right, they're going to miss time. They want to play. We all get that. Okay? We all get the fact, when you're working in athletics, everybody wants to play. Nobody wants to miss time. All right. We'll get into what the average length is for most concussions, about how much time people miss. But there are some serious side effects that can occur with actually playing a sport with a concussion. So that's another important thing. As you can see, most sports-related injuries, only about 5 to 10% actually are concussions. Now, concussion by sport, all right, obviously football has the highest amount, whether it's be in practice or in game. It's the nature of the beast. All right, it's a full contact sport. And when you see those numbers, that's what parents do, and kids do scare away from it. Right? They do stay away from it because of the fact of the high risk of a concussion. Right? But on the flip side of that, what's number 2 up there? Boys ice hockey. Ice hockey is growing tremendously, especially in Western Pennsylvania. There's a large number of students that play ice hockey. Right? Lacrosse in Pennsylvania, just in Pennsylvania alone, has seen, I want to say it's like about a 50 or 60% increase in the last 5 years in participation. It is growing leaps and bounds. And with lacrosse, you have a stick. Right? You can clock someone pretty good, right, with lacrosse. And when I used to work in a high school, I saw just as many concussions in lacrosse, boys lacrosse, as I did in football. Okay, so, pardon me? Well, girls, actually female athletes, adolescents, are actually more susceptible to concussions than males at the same age, and we will touch on it. There are reasons for that. Okay, but that is a good question. Why are some of these numbers up there and some aren't? So the fun part here is what exactly is a concussion, and that is a very long, in-depth definition of what a concussion is. All right. The important parts there are the ones that are either in bold or highlighted in yellow. So a concussion is a complex pathophysiological process, which obviously affects the brain. It is caused by biomechanical forces secondary to a direct or indirect force. Direct force, obviously, you hit your head. It's pretty cut and dry. Indirect forces, all right, whiplash. That's the best example of an indirect force. The main force is directed to the body. That force is then transmitted through the body to the head. That's how you get it. All right. It can be associated with normal structural imaging findings. All right. So one of the things that happens with a concussion, and this is perfectly acceptable for parents to do, all right, if your child does sustain a concussion, all right, you do want to rule out all the bad things that could potentially happen. Neck fracture, skull fracture, right? Subdural, epidural bleeding, all right? That's bleeding within the brain. You take them to the emergency room, they're going to do a CT scan or an MRI. You're ruling out all the bad stuff we don't want to talk about, okay? Most of the time, that stuff comes back, what? Normal, right? You don't have a cervical neck fracture. You don't have a skull fracture. There's no bleeding in the brain. Those two diagnostic tools, a CT scan and MRI, they do not diagnose. They cannot locate. Hey, there's a concussion in your brain. All right, you can't see it. All right, so those are going to come back. Is that better? So those are going to come back normal. All right. And then, as you can see there, the last part, there is a wealth of different signs and symptoms that can occur, which can affect someone, whether it be their physical, their cognitive, emotional, sleep-related symptoms. And we'll get into exactly what some of those are here in a bit. All right, but there is a wealth of different symptoms that are all sort of interchangeable, interconnected, and how they affect people. So basically how a concussion occurs, as you can see by the picture up there, as one hits the head, all right, you have to remember that your brain can move within your skull. It's just like an egg yolk inside an eggshell. It can move. All right? So once you hit your head, the force is transmitted, and there is movement of the brain. As the brain moves, hits the other side of the skull, that's where the damage occurs. All right? That's basically how a concussion occurs. Next thing, how do we identify and diagnose concussions? All right. So immediate signs and symptoms. A lot of people believe that you only have a concussion if there is loss of consciousness. Not true. Roughly only about, just actually less than 10% of concussions occur with a loss of consciousness. All right, so that is not necessarily true. I've had parents ask me, oh, you only get a concussion if you lose consciousness. I'm like, no. Right? Not true. Right? Obviously, you're going to see people that are dazed, they're confused, they're disorientated. They move clumsily. They answer slowly. Sometimes it's real important if you have a relationship or if you know the person beforehand, if you're diagnosing them, evaluating them, because then you sort of know how their normal mannerisms are, all right, how their memory is, and how they respond to questions. If you don't know them, this can be a little interesting, but obviously if someone doesn't know the play, goes to the wrong sideline, something's going on. There's a classic clip that happened a couple of years ago. It was Wisconsin was playing Alabama in one of the college football games. And the Wisconsin defensive player, made a great tackle, but he went to the Alabama huddle on the next play. Something was wrong there. But these are the common things that you see right away. All right, people are just dazed and confused. All right? The most commonly reported symptoms. All right, this is within 1 to 7 days after an injury. Obviously, a headache is number one. All right? Now, it's not the only one. If you ask someone, do you have a headache? Okay, you can't just automatically assume that they have a concussion. That's what sometimes people do. All right, you have a headache? All right, maybe their helmet doesn't fit properly. All right, maybe they're just having a bad day and they're stressed out and they actually do have a headache. Maybe they're dehydrated. Right? Because these are other things that can what? Cause a headache. Right? So ask about other symptoms, such as feeling slowed down, lack of, or having difficulty concentrating. Right? Bright lights irritate them. Right? Loud noises irritate them. Right? The thing you have to remember, though, is some of these symptoms, they take 12, 24, 36 hours to sometimes manifest or show themselves. Right? So you may have an individual that gets hit in the head on say a Friday. Right? Maybe they're a little dazed, they're confused, they're complaining of a headache, they're responding slowly, their eye movement's a little off. All right, you got a concussion, boom. They probably can't see a doctor till Monday. Well, over the weekend, you just tell them to relax, take it easy. They probably don't feel that bad. They're at home, they're resting, they're watching TV, they're getting some quality naps in, all right? They're eating right, they're studying, nothing too stressful. They don't feel that bad. Suddenly they go to school on Monday. And what happens? Well, whether you're in a middle school, you're in a high school, in between classes, all that movement, you go to lunch. All right? Lunch in cafeterias is a madhouse. All right? They're noisy. A lot of people moving around. Suddenly all those things start to what? Increase that individual's symptoms. So now they have the loud noises are bothering them. Their headache is now, instead of like a 2, it's like a 5. All right? The movement, just moving around the hallways. All right? Having to concentrate. Maybe they struggle with math or science and they have a tough math class. So having to focus for that amount of time increases their symptoms. So this is something that you have to be aware of and kind of pay attention to. So what we have here up now is different basic categories of symptoms. All right, you have cognitive, you have physical, mood, as well as sleep symptoms that can occur. The important thing you have to understand is how they're all interrelated. All right, so the symptoms kind of overlap, even though we kind of categorize them as this is like a mental one, this is a cognitive one, this is a physical problem. They all overlap and they all affect an individual's life. Right? That's the thing with a concussion that is important. Right? When an individual does sustain a concussion, it just doesn't affect their sport, because obviously they're withdrawn from that sport. Right? This can affect them academically. It can also affect them socially, right? Because they just don't feel like they want to go out. So you have to take that all into consideration. This slide here talks about, these are all red flags. So these are emergency signs and symptoms that if you see some of this stuff, yeah, you better be going to the emergency room. All right? Don't go straight there. Don't stop. So if you ever see someone who has one pupil larger than the other, all right, that is a major red flag. Weakness, numbness, all right, repeated vomiting that doesn't seem to be stopping. You might have them talking to them, hey, my headache's like about a 2 out of 10 right now. You come back, check on them in a couple minutes, maybe it's like a 3 or a 4. You notice that their headache is increasing in intensity over time, when over time you would hope that it starts to decrease. All right, so an increase in headache intensity, that's a red flag. Slurred speech, feeling drowsy, loss of consciousness. These are all red flags. Get them to the emergency room to rule out what? Some of those bad, life-threatening conditions that we talked about. Risk factors for concussion. If you had one previously, right, you're more susceptible to one. If you or or your family has a history of migraines, all right, you're more susceptible to concussions. We will touch on this in a few minutes about what a migraine can do for you if you have a history of migraines. All right, learning disabilities, dyslexia, ADD, ADHD, those individuals are more susceptible to concussions. Gender, females, all right. Age, younger population. All right, so adolescents, high school, middle school, even elementary school children, they're more susceptible than adults. All right, it's just a fact. It's just how it is. All right, and anybody that might have motion sensitivity, motion sickness, whether it be in a car, all right, they're more susceptible to it. Now, the gender, as I said, is more females. All right, one of the things that has been heavily researched, all right, in ways to prevent a concussion. So certain things you can do to help, not necessarily prevent, but decrease maybe the severity of concussion. Neck strength, core strength. Neck strength, core strength. Core strength, so core stability. Females compared to males at the same age group, a little less. So they're a little weaker. I'm not trying to say that badly. Okay? Those are reasons why. So, when you do look at a concussion, you're trying to evaluate a concussion, as I've kind of touched on, sometimes you need to go beyond that checklist. All right? So, do you have a headache? Are bright lights bothering you right now? Okay. Are loud noises bothering you? Do you have trouble seeing things? All right. Do you have trouble remembering things? Okay. Do you feel dizzy? Because you can have a headache. Right? Like I said, headache's the most common thing. But what can be causing that headache? All right. If it's August and you're in the first day of football camp or the second day of football camp, all right, could be 90 degrees outside. That person could be dehydrated. They could be tired. The helmet could not be fitted properly, right? They're not used to wearing a football helmet. Right? And that could be the reason they have a headache, right? Maybe they're not used to hitting, so on the second week of camp when you can actually start hitting, they're not used to hitting, so they're getting a headache just from like neck soreness. All right? I've presented to numerous, like hockey organizations. And one of the things parents say there is, yeah, my kid, we loosened the helmet a bit. Or their hair went from being shaggy and they get it cut nice and short. Right? Or vice versa, however you want to look at it. Just loosening the helmet just a tad, suddenly their head feels, the headache goes away. So there are other things to look at. All right. So the other thing there is what can trigger a concussion or what can trigger symptoms. All right. Obviously physical activity. And that example I gave about a student taking the weekend off, going to school, they're having to concentrate, having to focus. Large crowds, noisy environment, those can increase one's symptoms. Where are we at? All right. So, are there things that can happen, negative things that can happen if you don't report a concussion? If you remember, we said 50 to 70% of high school and college age students do not report their concussions. All right? Basically because of fear, they don't want to be removed, they want to play in the game. There is a condition, it's called second impact syndrome. And what that is you have a head injury, it doesn't fully heal, you go back, you play, you sustain another head injury. All right? It's not like one minor and another minor head injury equals a moderate head injury. One of the things that can happen is this can lead to death. You don't hear, you still hear about it, not as much as you did probably about 10 years ago. Okay? About 10 years ago, you'd always hear, especially in the fall, you'd always hear of a high school kid passing away. especially during camp. This was one of the causes of it. This led to a lot of states having concussion laws. All right. Pennsylvania does have one. It came out in, I want to say 2011, and we'll touch on what that is. All right, it's called the Youth Sports Safety Act. We'll touch on what that says. But a lot of, basically every state has one now. And those are designed to protect kids. All right. You mean the one where he got hurt in the Winter Classic? I don't know if he had one. I don't know the whole story behind that. And I don't know if he had one prior to that. Right before that hit and he fell and he hit his head. I know that was kind of caused more by like a whiplash from what I was kind of informed about the situation. But I can't speak on that. All right. So there is a heightened risk of re-injury within that 7 to 10 day period following a concussion. All right. That's important. So now we're going to talk about the management, the evaluation of a concussion. And this bit is very important. All right. How one evaluates a concussion, or what you as a parent would like to see. I guess that's probably the better way to look at it. If you're a parent, what do you want? How should your child be getting seen, all right, when this occurs? Because it isn't you have a headache. All right? You take a computerized baseline test, post-injury test, you compare the results. No. That's part of the equation. All right? And a lot has changed in like I said, I've been doing this for about 25 years, and what I was taught in school in the early 90s to what is taught and what I know now is night and day. And that's, how much science and research has changed. And the important thing is, for us here in Pittsburgh, we're lucky. And I don't know if everybody completely understands that, because we have some of the best doctors in the country. And some of the best research on concussions is coming out of Pittsburgh. All right? So that's a beautiful thing. So what should happen? All right? Ideally, you would like your child to have a baseline test. So a baseline test is a computerized test, and it measures certain things, right, in their, quote, normal state. All right? So the test we're going to talk about here near the end is called the IMPACT test, and that's the only FDA-approved neurocognitive test. Right? That just looks at verbal memory, visual memory, reaction time, and processing speed. So how the brain, how that individual processes information. It only looks at those 4 things. Okay? You want a baseline on that. You can survive if you don't have one, but there's an equation to this, a recipe to this evaluation. This is helpful because when you do the post-injury test, you have something to compare it to. As they go through the recovery of a concussion, you can give post-injury tests multiple times to see if their scores come back to what? Their baseline. So it's part of the equation, and it is very, very helpful. Obviously, if they sustain a concussion, if there is an athletic trainer there, they are removed. If there isn't an athletic trainer there, hopefully the coach notices the signs and symptoms of the concussion. If the kid complains about it, the coach removes them immediately. All right? Parent makes some phone calls. Hopefully within 1 to 3 days, that individual is being seen by a doctor. Okay? Like I said, there is a state law on concussions, and the state law basically says that if a child sustains a concussion or presents with concussion signs and symptoms, they must be seen by an MD or a DO who knows how to treat concussions. All right? True story. When I worked at a high school, I once had an individual present a note that they were seen by a gynecologist. They are a doctor, not necessarily trained to treat a concussion. That is a true story. All right. So MDDO, the law also states that they can see what we refer to as neuropsychologists. They are trained in how to deal sport-related concussions. All the doctors at UPMC and the concussion center are neuropsychologists. All right. An athletic trainer can also do an evaluation and remove that person from play, but we cannot clear them or allow them to go back to play. So they get evaluated, MDDO, neuropsychologist. And then there is, there can be treatment, there can be follow-up appointments, all right? And then hopefully, there is a return to play. There should be a return to play progression, all right? And that progression can take anywhere from about 3 to 5 days. And that is dictated by the physician, all right? So how long are people going to be out for? That's the question a lot of people ask. Well, how long is my kid going to be out for? Right. The average concussion that we see, or that you see, especially in the high school, middle school, 2 to 4 weeks. About 80 to 90% come back within a month. 2 to 4 weeks. In the grand scheme of things, that isn't that bad, if you think about it. I know that could be, if that's football, you're missing potentially 4 games. If it's lacrosse, you could be missing, 8 games, maybe more. You never know. But in the grand scheme of things, it really isn't that bad. All right? 2 to 4 weeks. I've had, when I worked at the high school, I had kids that were injured on a Friday night, and they played the following Friday night. So they only really they didn't even miss a week. All right? And they went through the proper protocol. So, the important thing is that we educate people and that you understand the signs and symptoms, and that, the sooner you tell us that you have a concussion, that you have the signs and symptoms, the treatment starts, the quicker you're back. The longest I've seen someone, so there's about these 10% of cases that can last longer than, you might say, a month, maybe even 3 months. The longest one I've ever dealt with was 18 months. And that was to a high school freshman, football player. He took a hit in a drill, so this was practice, took a hit hit his head, told the coach, I don't feel good, I need to see the athletic trainer. The coach was old school, told him to get back in line. He was a respectful young kid, hopped back in line, hit his head again. Unfortunately. Okay. It took 18 months. So he missed basically his freshman year, even half of his sophomore year. It's hard to say how long he would have been out if he had been allowed to come to us after just the first one. It's hard. You can't predict that. That's the thing. You can't predict that. You see an ankle sprain after you've been in this profession, the sports medicine profession, several years. You can kind of look at an ankle sprain and be like, you're going to miss a week. You're going to miss 2 weeks. Right? Give or take a few days. A concussion, you can't guarantee anything. I just told you most of them, 80, 90%, 2 to 4 weeks. All right? But then you're going to get that rare one, 18 months. So you can't predict it. You hope for the best, though. All right. So what you see now, these are, this slide talks about clinical trajectories. Right? And this was something that UPMC neuropsychologists came up with. And so based on hundreds of thousands of concussions that they've seen, right, they found out that there are certain signs and symptoms that were always present, and they kind of grouped them together. Right? So you have your risk factors, all right, which we talked about. You get a concussion, and then how these signs and symptoms present themselves. So, and then they came up with these 6 different types of concussions. And you'll hear people talk about this. All right, this has been well published, all right, in research about these trajectories. And so if you look at cognitive, obviously these people are going to have signs and symptoms with what? Memory. If you have a cervical one, your issue is with what? Your neck. So neck muscles are kind of causing you to get this concussion. Vestibular, balance, your eyes. Ocular, more your vision. Right? And you can have more than one of these trajectories. So you can have a primary, a secondary, even a tertiary trajectory. Right? They overlap. Right? Now the new thing they've found out, right? So the actual trajectories themselves are about, maybe about 5, 6 years old. The new thing, though, they found out is that there's a, quote, rehab or specific exercises that they can give people to get back from each one of these. If that makes sense. So if you sprain your ankle, we know that we have to decrease swelling, we have to work range of motion, we have to work strength, we have to work proprioception. Okay? Well, there are certain things that we can do for each one of these to help those individuals get back. One of the big things that doesn't matter which one you have, that has shown to be extremely beneficial is activity. All right? 1980, you probably had a concussion. You were told to probably go sit in a room, turn the lights off, sleep, come out in a week, and let me see you again. All right? Caveman therapy, cocoon therapy is how we refer to it as. All right? The new thing is, live a normal lifestyle. So, depending on how you feel, light activity is good for you. It's good for the brain. So, I'm not saying go run 5 miles or go lift, squat a couple hundred pounds, all right? But go for a walk, ride a stationary bike, as long as you feel able to do it. Your symptoms may go up 1 or 2, that's okay. What happens to them after the fact, that's also important. Do they quickly resolve? All right? So light activity, as you see fit, is actually very, very beneficial for you. That's the biggest one. The one with migraine up here, that's an interesting one, because what happens there is, I've never had a migraine. I don't suffer from migraines. But you have to think that this person suffers from migraine headaches. So, from what I've been told from people, those are just, or can be, insane. Right? Just very painful. And then sprinkle on top of that a concussion headache. So instead of having maybe like a headache of, your normal migraine might be a 7 out of 10, now you're out about a 14 out of 10. But over time, what happens is there's a change in the intensity of the headache, and our doctors know how to differentiate between the migraine versus the concussion headache. All right, it levels out. So that's basically what a migraine one is. The anxiety mood trajectory, that is seen commonly in individuals that they may have a pre-existing anxiety condition, all right, which is becoming sort of more prevalent in middle school, high school students. You do see a lot more anxiety issues. Even those that may suffer like ADD, ADHD, people with learning disabilities, you will see that trajectory with them. All right. Any questions on this stuff? All right. I know there was one of the Steelers this past year. He sustained a concussion, and he was quoted on, I think he was on one of the radio shows, and he was like, "Yeah, it was great." He said it wasn't great having a concussion, but he said it was great learning. To him, he was unaware of this, about there are 6 different types of concussion. So he was informed about this, all right, which was, to him, was pretty neat. So what ideally should happen, all right, so if you get a concussion, there should be a detailed interview. So that interview should be, what happened, how it happened, how long have you been suffering, what symptoms do you have, and when do they occur, how are they affecting you, all right? Is this affecting your work? Is this affecting schoolwork? Okay, and that sort of detailed interview exam down at our offices, that can take 15 to 20 minutes just doing that. All right? We want to know everything about how your symptoms, what were you doing, how bad are your symptoms, how is it affecting you? So we have the clear picture, all right, of what happened to you, how it's affecting you, what are you doing for it, all right? A symptom evaluation, that's just a checklist, all right? So you're presenting them with this, here's the typical concussion symptoms, and they rate themselves, all right? Pretty simple. The computerized testing, all right? Again, if you have that baseline test, this is where this is helpful because you can compare the results. And the important thing to remember about computerized testing is you can have a normal post-injury test and still have a concussion. Because remember what I said, the computerized test only looks at what? Well, specifically the impact test only looks at 4 things. Okay? So you can have a normal computerized test, still have a concussion. All right. They do a vestibular ocular screening, and this is called VOMS. It's vestibular ocular motor screening, something that, again, has heavily been researched, been publicized. It's out there. A lot of people do it. It is a very useful tool that we have to pick up little intricacies. It's all about eye movement, right? And how that can sort of increase some of your symptoms. Okay. And then you're looking obviously for patient feedback. All right. Is the doctor going to sit down, spend the time talking with you? And then do they need therapy? Do they need work? Academic accommodations, right? Do they need therapy? All right. And then above all, is there a return to play? Can you start exercising? All right. Most of the time these days you are walking out of there with some, go ahead and start, you're allowed to do this if you want. So does that make sense to everybody? It's kind of like the way I explain it. Sometimes if you go to your doctor and you say your knee hurts, a good doctor is going to sit down, talk to you, touch your knee, play with your knee, right? And it's looking like this, but we need to verify it. Well, what are they going to do to verify it? You're going to get an x-ray, you're going to get an MRI. All right, what other tests do we need? Excuse me. If you walk into your doctor and he just takes a look, doesn't touch you, doesn't talk to you, and says, let's get an x-ray and MRI, are you happy? Are you kind of satisfied with that, doctor? I wouldn't be. No. All right? So, in my present position, I do a lot of chatting with parents. A lot of parents call me, and I've heard stories of people they'll go see a doctor, and the doctor just puts them in a room, gives them a post-injury test, looks at the results, and says, "Nope, you're still concussed." And I'm like, "That's all they do? They don't talk to you? They don't do a system checklist?" They're like, "No." And my kid's getting very frustrated. They've been there 3 times. I'm like, "Oh, okay. Come see one of our doctors. You've got something else going on, which that test isn't picking up." And so that's not a good evaluation. That's not a good way to diagnose something. All right? They should be spending time with you. That's the important thing. Any questions on that? All right, so once this is properly diagnosed, now we got to know how to manage this. All right, do's and don'ts. So, like I said, you can do activity. That's most of the time. You're going to walk out, and if you come back and see one of our doctors, they're going to give you some type of activity you can't do, whether it be, and it's going to be low intensity, walking, riding a stationary bike. You can probably ride your own regular bike, but nothing too strenuous. All right. High impact, high risk activities, that's not a good thing. All right. Do not do the cocoon therapy, which is do not sit in a dark room. All right. You will still hear people that get told to do this by doctors. All right. At our clinics, there's people from all over the United States that come and see our doctors. All right. And you will see people from out of state. They end up coming to us because their doctors are telling them what? Sit in your room. You'll be fine. And what happens is, actually the reverse happens these days. Right? A lot of times the reverse happens. Their symptoms get worse, right? Because they're getting stressed out. There's an anxiety level. They're not getting better. The symptoms are just, instead of going down, they shoot up, right? The brain needs to be stimulated, just like as soon as possible, based on the severity of an ankle injury, you need to start walking on it, right? You need to start using it again. Well, the same thing with your brain. Your brain needs to be stimulated. So you can use, your phone. You can play video games. You can watch TV. If your symptoms get drastically worse, okay, back off. Turn the computer off. Turn the phone off. That's a challenging one for high school, middle school kids. Tell them to stay off their phone. But they can do it. If their symptoms go up, 3 to 4 points, that's when they got to turn it off. But can they spend, 10, 15 minutes on there? Sure. Watch movies. They can still do that, right? Go hang out with friends. Sure. Don't do anything stupid, though. That's another sometimes fun thing to do, or control with kids. But, so you don't want to just strict rest, all right? It just happened. Yeah, there's nothing wrong with taking a day or two, like pardon the term here, mental day, all right? And just what? Rest. There's nothing wrong with that. Right? But you don't want to take a 7-day mental vacation, so to speak. All right? You want to be stimulated. The brain needs light. The brain needs, needs to be stimulated. That's the important thing here. So you can walk. You don't have to ask someone every day what are their symptoms like. That's, kind of it can increase some anxiety on people, especially kids, right? They're probably upset enough as it is. They're not feeling too well. Don't bug them all the time. How do you feel? How do you feel? How do you feel? Right? Just let it go. And so those are the important things. All right. Any questions? Pardon me? No. Yes, that is a good question. It is important, and we'll get to it. It is important that you do eat properly. All right. So you have to make sure that you are eating, good nutritious food, just like you normally would, and staying hydrated. Because obviously, if you're not staying hydrated, you get dehydrated. What can that do? Cause a headache. So nutrition, hydration, getting proper sleep, all right? Those are all important things. That's a good question. Yeah, it's actually the next slide. So you want a regular sleep schedule. Maybe the first day or two, the person may want to nap a lot. It's okay. Might not be the best thing sometimes, but it's okay. If you're taking a couple of mental days, so to speak, yeah, it's okay. But regular sleep is important. All right. Eating a well-balanced diet is important. Hydration, extremely important. Physical activity. Again, yeah, you can do it. If you feel up to it, going for a light walk, riding a stationary bike, low risk activity. It's good, especially if you can get outside and do it. All right. And stress management. That's the other important part of this, especially for high school, middle school kids. Try not to get them too stressed out. They can be anxious enough as it is. They're upset. They know they're going to be out. Just try not to push them. Try not to bug them. How you feeling? How you feeling? Just let them go. All right? So, as you're going through this whole process, as your symptoms start to subside, hopefully your testing scores are coming back to their baseline. All right, there should be a return to play progression that the person should go through. And that return to play progression, ideally, is 5 stages. Physicians can dictate that, so they can shorten it. All right, we will talk about the 5 stages. But it's basically you start to increase activity each day. So day 1 might just be you ride a stationary bike for 15 to 20 minutes. Day 2 there might be like some squats, body weight squats, some jump turns, increase the biking to 30 minutes. So each day there is a gradual increase in activity. Day 4 could be a non-contact. You're going to do some practice drills. Day 5, you're back at full practice, maybe taking some contact. All right. Hopefully by then you get cleared. On day 4 or 5, you're going to get cleared. All right. So you want them symptom-free with exertion, and then you want normal tests. The impact test, that's the baseline test. The VOMS, that's the normal eye screening. And then an exit test, that's something we do down at UPMC. Okay. So it's a test full of different exertion activities. It takes about an hour to do. So any questions on the return to play? No. That is something that they should go through, because you just don't want to take an individual who hasn't really been doing much for 2 to 4 weeks and then throw them back into competition. Because there is a risk that, if you haven't exerted, right, going for a walk, riding a stationary bike is one thing, but when you get to that high impact level of exertion, can those symptoms come back? Yes, they can. So there is a return to learn also. You try not to overuse the academic accommodations, and academic accommodations are granted by the doctor. And it's based on signs and symptoms. All right, so if you know a person that has really bad vestibular ocular issues, they're going to have trouble at school with changing classes, being in the cafeteria, just because it's a loud environment, a lot is moving. All right, so they can limit that maybe to half days. If they have cognitive symptoms, they can limit you to half days. Give you accommodations for help taking tests, all right, note taking, those types of things. Right? We try not to overuse those though, all right, because you want to get that person back to what? Normal as possible. So, other things to consider. With the impact test, these are helpful to guide recommendations. All right, like I said, we'll talk about the impact test here in a minute, but the impact test does not diagnose, does not clear an athlete. All right, that's just useful, very useful information. When it comes to academic accommodations, different trajectories require different accommodations. Right? That's just how it is. All right. So symptoms are impairments. Sometimes they rapidly improve. All right. So sometimes you don't even need academic accommodations. You don't want to use an academic accommodation, pardon me, as saying this as a crutch. Right? You don't want to use it as an excuse. So these are some basic guidelines here on return to for academic accommodations. All right, as I said, you have cognitive. They're going to have trouble focusing. All right, intense classes, especially if they struggle at a subject. Like I'm not good at math, and they're in an advanced math class. They're going to have trouble with that. So they're going to need help, reduced workload, breaks. All right, extra time on tests. Right? People that have vestibular, ocular, they're going to have trouble focusing. They're also going to have trouble in the hallways. Sometimes these people are allowed to leave class, like go to their next class like 5 minutes early, so that they're avoiding that busy time. Now the important part, how long does this take? As I've kind of told you throughout this, most of the concussions you're going to see, 80–90%, recover within 3 weeks. That's not a bad thing. I mean, an ACL these days is, 6–7 months. 3 weeks. It's not that bad. If you think about it, it's really not that bad in the grand scheme of life. Most youth that we see recover in 2 to 4 weeks. There is that 10% chance, 10% of that population that is going to take longer than 3 months. I told you about the kid that I dealt with. It took him 18 months, unfortunately. All right. He also did suffer from, he had the migraine issue. He also had he suffered from ADD. So there were some other things, going on in there. So, questions on that? All right. So that's basically how what you should hope to see in the signs and symptoms, how one should evaluate a concussion, as well as how they are treated. Right? And that's where a lot of research is being focused on right now. A lot of our doctors are focusing on the research, on the recovery part of this. Okay, and that's what there's some new publications coming out right now that they're doing on the recovery, the treatment for each one of those trajectories. Right? And just the exercise alone is drastically improving this. And another important part is the length of a concussion is not dependent on the severity of the symptoms. It's how soon is that patient seen. So the sooner that they are seen, what happens? Well, obviously you realize where their impairments are, what their trajectory is, and then you can initiate the proper treatment. So that, again, is the important part here. As far as the impact test, all right, the impact test is useful and it's reliable. It's the only FDA-approved neurocognitive test. Right? Baseline testing as well as post-injury testing. There are some other tests out there, all right, but the impact is the only one that is FDA-approved. I do baseline testing basically on children 5 up to 18. So yes, I did say 5. So a 5-year-old, you can think of a 5-year-old can take a baseline test. Yes. There are 2 different versions of the impact test. So there's a pediatric version and then there's an adult version. The pediatric is, we do it on 5 to 9-year-olds. Okay. It's done on an iPad. It's your child and me, parents in the room. It's basically an educational video game. It takes about 15 minutes. Kids enjoy it. It's actually very fun to give. It's fun to watch the kids take it, right? And they enjoy it. And like I said, it's an educational video game. You mention the word video game, they get excited. That's the best way to sell them on it. We do the adult test. That's on 10 and up. So kids 10 and older, they can take the adult test. It's the same test, I would take. All right, that one's not as enjoyable. All right. Like I said, going back to what the impact does, it provides a lot of good information on how one is recovering. But you have to remember what? It's only looking at 4 things. Right? You can have a normal post-injury impact test and still have a concussion. Right? It is not used to diagnose, and it is not the only thing that you should be giving post-injury. Right? So it's not a substitution for that medical evaluation or the treatment. That is extremely important. Right? And the other thing with that is it does provide data. And a lot of people like data. They like numbers. So you can show parents, you can show coaches, here's their data. And that makes sense to them. Right? So this is what we do. We do the impact on the adult, 10 and older, pediatric, 5 to 9. Right? There's another test out there. It's called the C3 Logic test. I know some high schools around here use that. There are a couple other things you can do. So the Pennsylvania state law is called the Youth Sports Safety Act. It came in 2011. All right, and this basically was designed to help protect students and kind of clear the lines on how concussion should be cleared, and it also punishes coaches who do not pay attention to this. Right? So if a athlete, specifically, someone less than 18, is exhibiting or complains of signs and symptoms of a concussion, they should be removed immediately. No question. They should be removed from competition. Okay? They can, like I said, they then have to see a medical provider. Right? The appropriate medical provider is a physician, MD, DO, trained in the treatment of a concussion. So the treatment, how to properly evaluate a concussion. Neuropsychologist, they're accepted, right? Highly accepted. And then a certified athletic trainer who works under the direction of a physician is also accepted. So they must see one of those appropriate medical professionals. Coaches who do not pay attention to this, they can be punished. So they can be sort of banned for a year. They can be suspended. They can be banished sort of from coaching, right? Depending on the severity of this. Right? That's basically what this state law does. And then they must have a proper clearance note. Right? That's the other thing. The clearance note must be signed by an MD or a DO. Physician assistant does not count. Nurse practitioner does not count. It must be a MD or a DO. Just some other final things to consider, which are really important, I believe. Education, all right? Education on concussions, education on the evaluation, the treatment, the state laws. This is extremely important. It's important for students, parents, coaches, all right, administrators, just to know, what's out there, all right, and not to be afraid of it. Right? I usually get asked, would you let your child play football? I don't have kids. If I did, I would allow them to play football. I would, right? If they wanted to. If they wanted to play hockey, I'd allow them to play hockey. Right? You can't live in a bubble. That's how I look at it. You just can't. Equipment issues. Yeah, this is important. If you know football, hockey. The thing with equipment is make sure it's properly fitted. All right. And there's certain things you need to look for. You just don't go up to put on a chin strap and be like, yeah, it looks good. All right. There's certain things on either a football helmet, hockey helmet, how they should fit, the snugness, how the ear holes should line up, the appropriate height on the head, so to speak. These are things that parents, coaches should be doing, making sure equipment is fitted, is taken care of at the end of each year. All right, is certified, all right? Those types of things. There are helmets for soccer, rugby players. Most soccer players don't like wearing them, right, because they look stupid, they look funny. They don't like it. Does it help? You know, better than nothing. All right. Rules. Make sure you're following the rules. You know, you shouldn't be doing There's rules in hockey, youth hockey, about checking the age when you can start checking, when you can't start checking. All right. Soccer, when you can head the ball. Okay. I mean, it was last fall, I had about a 30-minute conversation with a parent whose daughter was being recruited, was supposedly a very, very good soccer player, because she was slightly taller than the average female, right, for her age, and she was very good at heading the ball. So corner kicks, right, direct kicks down in the offensive zone, they looked for her. She was very good, but the mom was obviously concerned about concussions. So this is when you start, okay, looking at neck strength, core strengthening, things that, it's not going to completely eliminate the concussion, but it could Could help them, right? Could help any kid. All right. The last thing up there is medical timeouts. So medical timeouts, that's just if an injury does occur, making sure officials are aware of, concussion, signs, symptoms. If they see a kid dazed, hey, let's take the time. Let's make sure we're treating these things properly. We're taking the time to evaluate this. We're not feeling rushed. With hockey, especially youth hockey, I hear a lot of stories from parents about, especially when they're starting to skate. There may only be like 6 kids on the ice at one time, but there's no checking going on. But they trip over skates. They slip on the ice. All right. And what happens? They fall, hit their head. Or they fall, they slide into the boards, hit their heads. With young kids, especially like that 5 to 9 age group, sometimes it isn't even the kid's fault. They're at recess, gym class, and what happens? An errant ball comes flying across the room and cracks them in the head, unfortunately. All right? It's unfortunate. It's a fact of life that, stuff happens. I hate to say it, but it does. So sometimes it's not even the kid's fault. A kid falls on the ice, especially once the beginning of the period, if they've just resurfaced it. That's slick. That stuff is slick. So, does anybody have any questions? Yeah. In regards to the trajectories, I wouldn't. No. I mean, because like when I first started out in this profession when I was in school, we actually had grades of concussions. So you had a grade 1, grade 2, grade 3. I think there was I think it went up to like 6 or 7 at that time. Now there really isn't. You don't grade them. We don't grade them today. You just say you're concussed, right? You have a concussion. So if you want to know, is one worse than the other? No. I mean, if you're thinking of symptoms, like if you're talking about a migraine trajectory, yeah, you're going to be suffering from some headaches. Is that bad? I don't know. If you take a migraine headache and then sprinkle on top of it another concussion headache, to me that would be bad. But I think there's that subjective element to this, to asking that patient. And is one worse than the other? No. Like, is one type worse than the other? Because like I said, you can actually have a primary, secondary, and a tertiary trajectory. You could suffer from 3 of those. Yeah. So I don't think there's one that's worse than the other. It's just it's the cumulative, the additive effect of everything. I mean, post-injury? So like once he was cleared, like after that 18 months, he was cleared. Um, no, like that individual. Um, he was a very good young man. He really was. I mean, and to see anybody suffer like that for that long, it was not fun. Um, but he handled it very well, and he tried to, we tried a lot of different things with him to see if he could, come back. Um, and he did very well. It was just one of those things. Finally, everything just subsided. Uh, when he did come back, he didn't have any issues. Like when he was officially fully fully cleared, you don't have to come back and see the doctor anymore. You're full go, no worries. You've got the stamp of approval. No, he didn't have any issues. No, I mean, his biggest thing was just um, he did suffer from some migraines. He did have some anxiety. He did have, I believe it was either ADD or ADHD. So he had some other things on top of that. Yeah, pre-concussion. Yeah, so he had some other things which predisposed him to this, and then obviously, kind of like the double impact, he had to suffer. Um, so his biggest thing was just the lingering headaches, some anxiety that he had to overcome and deal with, because we try and you know increase his exertion, increases his physical activity, but what would happen is his symptoms would shoot up, and then he started worrying about this, worrying about that. Am I going to play? Am I not going to play? I mean, it's typical for a high school kid to think like that. Because they want to play.
So, in football, you see, helmets on.
Mm-hmm.
Okay. Why does the hitter get to walk away most of the time, and the kid have to go get evaluated? Shouldn't both of them be evaluated at that time?
Are you talking about like more of the National Football League? Um, I can't 100% answer that question for you. All right, the NFL has very strict guidelines in place. They have their own concussion protocol. All right, like whether it occurs in a game, at a practice, they have their own protocol, and which is in depth. I've seen it. I've read it. Um, and even in a game, you know, uh, you know, the athletic training staff on most NFL teams is like 5 to 7. You're talking another what, 4 or 5 doctors on the sideline which are paying attention. You've got 2 people up in the sky, so to speak, paying attention to this. Um, you know, and the NFL puts a lot of money into researching on helmet design, right, to make those as safe as possible. But why? I understand what you're saying. Why does it seem like the guy who's always getting hit, the one who suffers it, is that because they're not, properly anticipating the hit or bracing themselves or putting themselves in a position to absorb that force? Does that make sense? I mean, yeah, I can't give you a direct, definitive answer, but it's the one that's looking more dazed and confused. And based on even, you always hear this every year. I mean, I know this came out a couple of weeks ago. There was a guy, I can't remember where he played for, but he said, yeah, he played through a concussion this year. I can't remember what team he played for, but he did. He actually did stay. I played through a concussion this season. But the NFL, they do. People question them a lot, but trust me, it's just like hockey. They do have very, very strict policies. They have very strict, detailed, in-game practice guidelines, which they have to follow. And you can't see everything. I mean, you can't. Yeah. Oh. to
Do they say support extra? Do you reply to youth volunteer coaches?
the yeah, like any coach. So if you're talking Pee Wee football, right, that applies to them. Pee Wee hockey, it applies to them. It's not just your high school coach, your middle school coach. It's anybody. Yeah, that should be any coach, and that's where this, because every coach has to. They do have to do a concussion education. It's usually done online. That's what most, whether it be organizations, schools, they tell their coaches there's an online program they can, class, so to speak, that they can take. But they do have to be educated on this. Now, how much they pay attention to that, I don't know. How much they believe in it, I don't know. I mean, I've dealt with coaches at the high school level that say a concussion is a fake injury. Yeah. Okay. Yeah. All right. I mean, I can tell you a story. I know we need to finish up here, but I can tell you a very quick story of this was when I was in school. So this is like mid '90s, and we had a freshman football player who got. There was a one-on-one drill. So back then, this is in the '90s. It was basically the same thing as like an Oklahoma drill, which was, here's your running back, you're going against a linebacker. Well, he took a freshman running back against a senior all Big Ten linebacker. Well, you can only imagine what happened to the poor little freshman. He got clocked. I took him in. We had a team doctor, so I took him, the staff told me to take him in to see the doctor, our team doctor. And the team doctor sat him down, and he asked him, "What's your name?" I can ask you, "What's your name? What's your name? What's your name?" Within less than a second, you can tell me what your name is. This poor gentleman sat there, kept thinking, and when you have the answer on the tip of your tongue, but yet it's driving you crazy because you can't think of it. What's the name of that movie that so-and-so was in, right? After about 5 minutes, he got his name. I'm not lying. He didn't ask him what his last name was. He stopped at the first name. And we shipped him right out to the emergency room. Yeah, and that is, and like I said, this was 20 years ago. Okay, but yeah, this is some of the crazy stuff you see. And like I said, things have changed. They still are changing. A lot of new advances coming out every day, every month, every year. But it is, and the beautiful thing we have here in Pittsburgh is we have that availability of some of the top doctors in the country. I don't think a lot of people fully understand that or appreciate that. I know they made a movie on here, about concussion with Will Smith. All right. But you rarely do. We have some of the best doctors in the country, the best care in the country, right here. And I wish more people would utilize that. So, but thank you very much for having me. This was a fun event. All right. If you have any questions, my contact information is up there.